Today, I'm joined by the County Executive, Warren Evans, by the Head of Detroit at Work, Nicole Sherrard-Freeman, and as always, Denise Fair. Let me give you an update on what's happened in the last 24 hours and start where we normally do with the Detroit Police Department. I think as we've been talking about, we have dramatically accelerated the testing of all of our officers. As of today, we have 91 employees of the Detroit Police Department that have tested positive for COVID-19 and 17 employees of the Detroit Fire Department. Today we have 525 officers who are quarantined, but I'm pleased to report 120 officers have returned to work and are back on the job. We are speeding up the testing process. We are speeding up everything about this to get our healthy officers back. We have 136 members of the Detroit Fire Department currently quarantined and isolated. Last night again, the 911 response time was excellent. It was about 10 minutes. We are benefiting enormously from a major reduction in crime and 911 calls. That's, I'm certain, resulting from the shelter-in-place order, same kind of thing that the city of New York has seen. But the fact that Detroiters are pulling together in this way is making it possible for us to continue to run smoothly at the Detroit Police and Fire Departments until we can get the rest of our officers back. The process is pretty interesting now, as I've talked about before. We put a thermometer on everyone at the Detroit Police and Fire Department as they come into work, and I got two alerts this morning, the first two. We had one officer who came in over 100 degrees and one firefighter who came in over 100 degrees and were immediately sent home. This is the kind of rigor that maybe had Michigan been a little later in the process, we would have known to put in place. But I'm talking to the U.S. Conference of Mayors on Friday, and they all want to talk about if you had known earlier what to do, what would you have done? And yesterday I noticed I was doing an MSNBC interview, and there was a police officer in Miami standing right next to the reporter with the microphone. I said, you would never see that in Michigan again. Parts of this country still don't get what separation means. There's something about us that until you see the virus having an effect, we don't act. But I'm going to be talking to my fellow mayors on Friday about the actions you need to take before the virus hits your community. And certainly we would have put much more distance between our police officers earlier. Denise Fair is going to give you the numbers, but our positive tests for Detroiters jumped about 400. This is a function of our very successful testing program, and you're going to see the number of Detroiters who test positive climb by significant numbers every single day. And I am going to ask maybe for some self-reflection on the part of the media in the way this story is being reported. It's been kind of disturbing to me to see stories written about why is Detroit a hotspot, with all kinds of theories about poverty and people not taking care of their health. And I tell you what I find so disturbing. One of the wealthiest communities in New York, New Rochelle, had the first major outbreak on the East Coast. Middlesex County in Massachusetts, a very well-off county, has a significant outbreak of coronavirus. And here in Michigan, it has been the city of Detroit and Oakland County that has had the highest concentration. But nobody goes and writes stories about why is New Rochelle a hotspot? Why is Middlesex County a hotspot? Why is Oakland County a hotspot? Why is Oakland County got higher death rates than suburban Macomb and Western Wayne? And so it seems to give people leave to throw out whatever theories they want about why a poor city like Detroit is a hotspot. And I spoke to Dr. Mark Zervis this morning, who was also deeply disturbed by this coverage. And he said, there is no evidence that the coronavirus checks your bank account. before it jumps to you. There's no evidence that this spreads more quickly among the poor than the wealthy. In fact, the overall history of the country is the opposite. And so we have a very serious problem in the city. We lost a number of other members of our community even yesterday. But Detroit is hit early for the same reason Oakland County is hit early, for the same reason Kings County, Washington was hit early, for the same reason New Rochelle, New York was hit early. Somebody brought the virus into this community early on. It spread in this community before we knew what was happening. And the places in this country that are getting hit are the places that were infected first. And now we are working together with, I think, great leadership from the governor to fight it off. But I would just ask you in the media to just reflect on what you're writing. And when I see a headline, when you have essentially the same number of fatalities in Detroit and Oakland County, and yet I see a headline yesterday, Detroit has 1/3 of all the deaths in Michigan. And you say, wait a minute, what prompted you when you had two entities at the same level to pick one and put it in the headline? I'm just asking that maybe you reflect in the way that you are covering this. We have more progress that is being made to help our businesses. Yesterday, we sat here and Kevin Johnson rolled out a $3.1 million fund for small businesses. Today, I'm partnering with County Executive Warren Evans, and thanks to the support of the state of Michigan, MEDC, the Michigan Strategic Fund, there's another $1.6 million that are available. And so since we announced this yesterday, we've had 300 companies that have already applied for the $2,500 to $10,000 support to keep going. And now with the county executive support, we're adding another $1.6 million, and we're going to run a single program. You only apply once, and the county executive and I have put our staffs together in a single team to make it easy for you. And with that, I'll turn it over to Warren Evans to talk about the details of how this is going to work.
Well, thank you, Mr. Mayor. I appreciate it, and I also co-sign your sentiments about reporting. We're clearly in a crisis here, and the county and the city have seen fit to partner in an application with the state for small business grant funding. The funding will be generally capped between $2,000 and $10,000. But one of the things that's really important about it is the speed with which these efforts are going on. The county also last week put together a program, a $10 million program for small businesses in Wayne County. And while this virus has been speedy and spreading, and the significance of our testing quickly and social distancing the way it needs to be, we also need to provide speedy relief to our small businesses. And I also echo the mayor's sentiments in how quickly and positively people have been responding to apply for the funds. They are grant funds in this program with Wayne County's economic development and the DEGC to the tune of about $1.6 million. We want to get that in the hands of the qualified businesses as quickly as we can, so that they're able to keep sustaining themselves. It's April the 1st. Everybody knows what happens the first of the month. Your bills come due, and when the revenue's not coming due, that's an issue. So we think it's a great program, and Mayor, thank you very much for partnering with us to do it. And if there are other questions later, we'd be happy to answer them.
Thank you, Mr. County Executive. For those who are sitting at home and want to make money, whether you've been laid off or would like to go back to work, everything is not being cut right now. There are 1,100 jobs available for Detroiters where people are hiring right now. They are in the essential industries, and they are jobs like working at the grocery stores, at Meijer's, at CVS, at Mike's Fresh Market. They're hiring both for the retail clerks and for people stocking the shelves. We've got a number of companies hiring drivers, companies like Black and Mobile that serve 10 different restaurants taking food to residents' homes, and U.S. Ice transporting dry ice for storage. Henry Ford Health System is hiring folks from the people who push the wheelchairs to the people who clean the rooms. There are 1,100 jobs that if you go to Detroit at work, you could be working really in a matter of a couple of days. This isn't, 4 weeks ago, Nicole Sherrod-Freeman was hiring for the Chrysler plant on the east side. The world has changed, and now we're hiring for the jobs that are open today, but there are opportunities, and with that, I'll turn it over to Nicole Sherrod-Freeman to talk about what's out there and how you go about applying for it.
Thank you, Mayor, and thanks for your leadership on this. So as the Mayor said, there are more than 1,100 jobs open right now, and we want to direct you to DetroitAtWork.com, just like we did for FCA. You go to DetroitAtWork.com, you scroll down to the Ready to Hire initiative. It's a special call-out button. You click on that. You give us a little bit of information about yourself so that we can also connect you with other resources, and then you can apply for the jobs that the Mayor has mentioned, along with many others. Now, some of these jobs require customer contact, but many of them do not. So some of the delivery driver roles don't require any contact. You're loading into the back of the truck or off the back of the truck doesn't require you to come in contact with any people. There are loaders. There's a distribution company over on East 8 Mile that's looking for loaders at about $14 an hour. So many of these jobs pay in the $10 to $12 an hour range, but there's also a wide range of jobs that pay $14 an hour or more. And these companies are either expanding their businesses as a result of the virus, or they are backfilling workers who need some time off. So I just ask you to go to DetroitAtWork.com, or if you don't have access to the internet, I'm going to ask you to call 313-962-WORK. Again, that's 313-962-WORK, WORK, and we can help you by linking you with an opportunity that fits your interests and your skills. Thanks, Mayor.
Thanks, Nicole. And we close always with the hardest part of these sessions to update you on the impact on our neighbors. I just came from visiting the new field hospital that the Army Corps of Engineers is so skillfully setting up at the TCF Center. It's going to have in the range of 750 beds if we need them, and the governor and I went over and visited. It's very impressive. I very much hope we don't need it. If we can listen to what Director Fair is saying about social distancing, there's still a chance that we can avoid it. But we're preparing as if the surge is still coming, and if we hit the point where we can't take care of all of our sick neighbors in the hospitals. And so the plan is to have several hundred beds at the TCF Center for coronavirus patients. The idea would be that as you come off the ventilator and you're recovering, that you're moved from the hospitals and recover over at the field hospital at the TCF Center to make room for other patients to be on the ventilators and other patients to occupy the hospital beds. You can't look at that hospital and not be hit by the magnitude of what our community is going through. And with that, for the update on the latest numbers, Director Fair.
Thank you, Mayor Duggan, and again, thank you for your leadership. So as of today, there are 2,483 confirmed cases and 82 confirmed deaths. Now, as compared to yesterday, this is 400 more positive cases and 9 more deaths, again, just from yesterday. Now, we're going to see the number of cases continue to increase because of the work that we're doing now at the drive-through testing at the State Fairgrounds. And again, this is what we should be doing. We are testing. So again, you're going to see the numbers continue to rise. Now, we know this virus has no geographic boundaries, and COVID-19 has been and will continue to be an equal opportunity virus. Now, we don't have all the answers. However, as more residents continue to get tested, we'll have a greater understanding of the how and the why. And we are looking at our data. We've noticed that cases are all across the city of Detroit. Now, the role of the Detroit Health Department is to provide communication, education, surveillance, and emergency preparedness towards ensuring the health and safety of our community. Now, because COVID-19 has no boundaries, we need to do our part. We need to heed the governor's executive order, which is staying at home. And I know I sound like a broken record, but I want to make sure people are listening. Stay home. If we stay home, we will help to slow the spread of COVID-19. And it's time that we hold ourselves accountable and those that we love, because what we choose to do or what we don't choose to do will impact others. Please visit the Detroit Health Department. We have the latest information on our website at detroitmi.gov/coronavirus. You can also call us if you have questions or concerns 24 hours a day, 7 days a week at 313-876-4000. And again, I will say, please stay home so that we can slow the spread of COVID-19. And with that, I'll turn it over to the mayor.
So a few other items before we take questions. The testing equipment from Abbott Labs arrived today. It's being set up right now, and it's becoming clear that Detroit will be the first city in the country to use the 15-minute testing to test our police officers, firefighters, EMTs, and our bus drivers, so that we know right away the results. And that's going to be up and running in the next 24 hours. For those in the media that want images of it, I'm sure John Roach will figure out how to work that out before we start having patients come through. We had another 600 people tested at the fairgrounds today. We've booked 3,000 appointments at this point, and we're getting a lot more calls from folks who have now gotten a doctor because of the 22 new doctor's offices, and as of now it's 25. We've had 3 more added since yesterday. There are 25 doctor's offices in the city that will take new patients. Most of them don't care whether you're insured or not. You can sign up. We had a number of transportation companies come forward, and we're negotiating the agreements now. I'm very hopeful that by Friday, those individuals in our city who don't have a car, don't have transportation, that we will have a means to get you a ride to the drive-through testing center to make those tests available to every single Detroiter. And we're working out the details right now, but basically the cab services or the transportation services will just be brought right to the front of the line so they can go straight through, take the patient back home, and the transportation companies can continue to do their work. And so I think we'll have more on that in the next 24 to 48 hours. But we're going to keep going until we get everybody in the city to have equal access to testing. Senator Stabenow says that the FEMA 200,000 swabs are on the way, but so far nobody spotted the FEMA truck. But we are continuing to pull together swabs and test kits from different areas. And I'm hopeful before the end of next week we have enough materials to be up to 1,000 tests a day. The Fairgrounds program, I know a lot of folks have gone through it, and the reaction I'm getting is almost universally positive in their experience. With that, we'll take any questions.
Mayor, before the reporters come up to the microphone, we've got one question wanting to know, this could be either for you or Chief Fair, in terms of whether it's time to go beyond just social distancing and encouraging people to always wear a mask when they go outdoors.
So the question is, and I'll let the director talk about it, basically I put a mask on from my car to in a building and back if I think there's going to be random interactions. And the mask does as much to keep you from potentially spreading germs to somebody else. And so we're going to follow the state guidelines and the federal guidelines, but I see more and more people walking, riding bikes with masks. I think it's a good thing, and I'll give it to our health professional to ask her opinion. Director?
Sure. I think as a precautionary measure, if you feel as though the mask will protect you, then by all means. I think it's important that we do follow the CDC guidelines as well as the state.
Okay. Mr. Mayor, Ross Jones wants to know what measures are being taken to ensure that the city's EMS operators are able to meet the growing demand for service as COVID spreads, and are there any plans to add additional resources?
I'm sorry, I missed the middle of that question.
So as COVID spreads, are we doing anything to prepare for a surge in EMS runs?
Well, we've had a surge in EMS runs, and our EMS workers are doing a terrific job. So the answer is yes. We check the staffing every single day. We have been extremely fortunate that while we've had a lot of positive COVID-19 among police officers, we've had very little among EMTs. Our EMTs are so used to protecting themselves from communicable diseases 24 hours a day, 365 days a year. I think maybe they were better prepared. But I talk to Fire Commissioner Eric Jones every day, and so far, the EMTs are doing a great job.
Okay. And you'd like to know, do you foresee a time when we might need to bring in additional resources?
Yeah, I'm not in the business of predicting the future. We're prepared. We have preparation plans for all alternatives, but most of the folks who are heading in on COVID-19 aren't going in an ambulance. Some do, but I'm not sure I haven't seen that that's going to be the problem point. A week from now, it may be a different story, but today, we're not seeing that.
Okay. One question on the small business fund. It could be for County Executive Evans or for the mayor to elaborate a little bit more on what the difference is between the fund that was announced today and the one that was announced yesterday.
One of the nice things is it seems like every couple of days we're announcing one, but the county's loan program with TCF is a little different in that, first of all, it is a loan, a low-interest loan between 1% and 2%. What we're announcing today in conjunction with the City of Detroit is a grant program that has a little difference. This one is between $2,500 and $10,000 max, provided you meet the qualifications. The TCF loan program is between, I think, $5,000 and $50,000. And I'm really happy that so many firms have started to begin the process. It's something that if they don't know, the initial one with TCF, just call any of the TCF branches. We're making it very, very simple for people to apply, and the same will be true of this. And additional information they can get at waynecounty.com. I didn't mention it earlier, but I should have. It'll help walk you through it.
So yesterday's program was Detroit only. Today's program includes the 42 communities in Wayne County outside the city of Detroit. And if you just go to the website, it will take you through the steps. But you can't, on the 3.1 million we announced yesterday and the 1.6 today, we're going to run that in a coordinated fashion. So you only apply once. The county executive staff and the city staff will figure it out together and award it once. You're going to find it to be very streamlined if you just go to the site.
Okay. One question from ML Elric at the Free Press is that there's been reports of there being 900 beds planned for the TCF Center. You'd mentioned 750.
Yeah.
Do you know?
So you should go with the official announcements. And so if they're saying 900, I'm sure it's the case. They're still in the stage of setting it up. So don't take my number as the precise number. The Armored Corps knows what it was. I saw 750 today, but they were still installing, so I'm sure 900, if that's what they say is the intended number. They've got a second room downstairs.
Okay, so last question for now from reporters who are not here is, are you tracking the crime trends? What are you seeing? There were couple homicides reported in the last 24 hours. And Fox 2 wanted to know what your thoughts are on that.
Yeah. You know, the last 10 days or so, the calls for service and crime have been down dramatically, but the city is too violent. And I hope this is a time where we embrace each other instead of turning on each other.
Ben Foldy at the Wall Street Journal. So you mentioned that one of the, the virus doesn't discriminate based on income, but one thing that does seem to stand out, at least in the Detroit area and Michigan more broadly, is the fatality rate. Is there any insight into why there's more deaths here than there are elsewhere?
Again, I don't know why you would say that. I guess you can take a look at the numbers. Of course, our fatality rate doesn't come anywhere near New York's. So question is, why is New York higher? But if you look at it, Detroit's fatality rate is a little higher than Oakland County's. Oakland County's is double Macomb and Western Wayne counties, or I shouldn't say that. Oakland County is about 50% more than Macomb and Western Wayne, and about double Washtenaw. And again, I would say you should talk to somebody like Mark Zervis, not people who pop off theories to be quoted in the paper. But I think Dr. Zervis would tell you that that usually reflects that people who brought the infection into the community, that it spread longer in the community. The longer the infection's in the community, the more people you have where the disease has progressed, that they're on the ventilators. And if you look at the number of deaths daily in New York, you see what is happening. But this is hitting all of us hard. My objection is a suggestion that it's not hitting wealthy areas as well as poor areas. This COVID-19 is hitting everybody.
Hi everyone, Eli Newman, WDET. First, I just wanted to get some clarification on the emergency responder numbers. So today we have 91 positive cases with DPD and 17 with the fire department.
Right.
And 520 in quarantine at DPD. And how many in quarantine at DFD?
136.
136, and 120 came back to work today.
Right. At DPD. 120 are back to work at DPD over the last few days.
Sure. So it seems like those numbers are similar to yesterday's numbers in terms of the total number of people in quarantine. So did like 100 people come into quarantine over the last day? Or
I think 40. 40 came in yesterday into quarantine, and I think 70-some came out, something like that. We could get you the exact numbers, but it's something to that effect. But I'm trying to go from memory, but I think it was 40. I could look it up for you if you want.
Sure, yeah, that's fine. We'll get to it later. Executive Warren, I wanted to ask, there was a staged walkout planned in the Romulus Amazon facility. I was over concerns of some of the positive cases that had transpired there. I'm wondering if you've shared any of those concerns that some of the workers there have expressed about their workplace facility.
We're always going to be concerned with the workers' safety. I'm not specifically aware of what the underlying issues were there, whether it was social distancing issues or whether it was disinfectant issues. I'm not sure, but we certainly are interested through the health department to make sure that the guidelines for remaining open are being met in terms of the criteria. So I just probably an hour ago heard about that, and I don't really have the background with respect to it. But I mean, it's a scary situation for everyone, and certainly the employees are fearful, and rightfully so. And I think most of the employers are employing the right techniques to make the workplace as safe as possible. But we'll certainly have to look at this and see just what it is.
Sure, and a question for Director Fair. In 2018, the city put out a state of the city health report that I think was co-authored by your predecessor, our state health director. One of the things that came out of it just quoting it right now, the socioeconomic impact of our behaviors and environment on our health far outweigh that of our clinical care. The report also notes that most neighborhoods in Detroit have life expectancy that is lower than surrounding suburbs, and that most Detroiters rate their health as fair or poor. Do any of those factors drive on what we're seeing in terms of infection rates here in Detroit or in the fatality rate?
So I think and thanks for your question, I think the mayor already addressed this, but we are finding, and this is nothing new, in Detroit there are people that are living with asthma, underlying healthcare conditions such as lung disease, hypertension, and so this is nothing new, and I know Jonay put together a report that looked at all the health status of the city, but again, this virus is something that we are learning about every single day, and as I mentioned, COVID-19 has no geographic boundary at all, so it's going to affect us all, and as I mentioned, the best way to help slow the spread of COVID-19 is just to remain home. We can beat this. People need to listen, and people need to stay home.
So I looked up the number 31 police officers were quarantined today, and we had about 75 come back, so we headed the right direction. On your other question, again, I'll go from my conversation with Dr. Zervos. There's no reason to believe that the health conditions affect the infection rate. Dr. Caldoun issued that report in my administration. It's absolutely true. There's no question. Detroiters suffer from kidney disease, from heart disease, from asthma at rates typically double that of the surrounding communities. That doesn't affect the infection rate. It may affect the fatality rate. If you are older or you already have breathing issues, you are more vulnerable to be affected badly. There's no question about that. And so I just want to be clear on what I'm saying, is the suggestion that it is spread more here than New Rochelle or Middlesex County. There's no evidence for that. But every individual person, I'm very careful with my 83-year-old mother. I don't go see her without a mask on. Now, she lives in a wealthy neighborhood, and she's healthy, but she's a high-risk person. We have a lot of senior citizens in this city. So there's a lot of reasons why Detroiters can be vulnerable, and a lot of really good reasons we should practice social distancing.
Sure. Now that the city has plotted out some of this data on the website, we got a heat map, we got age demographics, and other statistics. I'm wondering, is the city now using that data to kind of plan for future weeks of how to address this issue to testing centers or field hospitals or anything like that?
The world is never going to be the same. We are probably never going to shake hands and hug as quickly as we did before. We're probably going to wash our hands far more frequently. And at some point, treatments and a vaccine for the coronavirus will be developed. It doesn't mean in 3 or 4 or 5 years some other strain of virus doesn't come up, and I think all of us are so much more aware than we were 3 or 4 weeks ago. What our long-term change in behavior is, I think we're all going to discover together.
Great, thank you.
Mayor, just a couple of basic questions. I think these might be the last ones. One is of the 91 personnel from DPD that have tested positive, are they all officers, or is it a mix of civilian and
I don't know if I have that broken down, but let me just look at the report that Assistant Chief White sent me this morning. So I do. So of the 91, 76 would be officers and 15 would be other positions, civilians and other positions.
Okay, and last one is for testing, for the need for referrals to be tested for the prescriptions, is that just based on, this is from WWJ, is that based on just the limited supply of the test kits?
No. So a doctor can use their judgment Any doctor can use their judgment as to whether you need a test. So your doctor, if you go to them, if you are showing symptoms, I suspect they will prescribe a test. And as I said, we had 3,000 prescribed already. The problem continues to be that the standard test is just not as accurate as it should be before you have symptoms. The only test, at least that the FDA says is accurate before symptoms, is the Abbott Instant test that we'll be putting in place here, but that's going to be for first responders. But for pretty much everybody else, if you don't have symptoms, the test is not reliable enough. And so the doctors, if you have symptoms, should be prescribing the test, in which case we'll get you right in. If you don't have symptoms, the doctors should not be prescribing you tests. And that, at least from what I could see, is what's happening today.
Okay.
All right, anything else?
So I want to be careful how I phrase this because I am mindful of, this virus doesn't discriminate based on geography. That said, I think I moved here 9 months ago from New York. I wouldn't assume to know what specific geography or demographic or cultural things make containing and fighting this. Like what, if you think about New York, you have subways, you have high population density, you have all of these things that make it more difficult to fight COVID in New York. What are the Detroit-specific elements of that? What are the particular challenges that you're facing?
Yeah, density is an issue. People in apartment buildings are more at risk than people in single-family homes. People in nursing homes are more at risk than people in apartment buildings. People crowded on a basketball court or in a park are more at risk than anybody. Density drives the spread of any virus, and I think Detroiters, from what I'm seeing, the vast majority of Detroiters are taking this very seriously. And probably the one thing that bothers me are the lines with the lotto tickets, and we got to find a way for people not to be so clustered together. But I'm all over this city, and I see the vast majority of people in this city strongly complying. And I'm hearing anecdotes when groups are gathering that neighbors are coming out and saying, don't do that. And that's when we'll really be effective, and I will say this over and over, the health workers in our hospitals with these jammed wards are risking their lives every day. It is enormously disrespectful to the men and women in the hospitals for people to be clustering, because they're fighting to protect you, and we just really ask that you protect your neighbors. And with that, thank you all.